Hi, people. Last time we had a guest as a pediatrician. Today we are having a person. I'm not going to mention his branch, but I'm going to tell more about him. He's a person who can literally see what you can't see. You can just imagine, but he is the person who can see what you can't see. So from this, you could have decipher. Today I'm going to be talking with a radiologist. He is none other than my friend, Dr. Deepak. He did his MD radiology from the All India Institutes of Medical Sciences, Raipur. Now he's embarking on a new journey, which we will be further decoding from this talk. So, hi Deepak, how are you? It's been 2 months
Hi,
since we
Adil.
met last in Raipur.
Yeah. It's a much long time actually.
Yeah,
Thanks for the warm intro.
yeah. This is actually it's a very small intro I gave to you because you need a big intro because we'll be talking more about you. So,
Definitely will be.
how is the transition between a junior resident and now to a consultant radiologist, reporting scans individually and just signing over them?
Yeah, actually, I have just passed in the January 2026, and then after that, I started working in a diagnostic centers in Chennai. Currently, it's more of a clinical branch rather than a non-clinical or a paraclinical, which people used to have a like false hope about it, or something which we can easily sail through it. Unlike a clinical branch, we don't need to take responsibilities. It's not like that at all.
Okay,
It's more of a we need to take more responsibility for both the patient side and from the clinician side. You need to you need to solve the query each and every time when there is a diagnostic dilemma. You are the person who pops out early, and you will clear all those doubts, so
yeah,
the
Deepak,
patients and clinician
I
both will
understand
be
because
happy.
I've seen you people work and I have been more to radiology consoles to discuss cases with the people and
Yeah,
that
definitely.
you provide more insights than what we can actually clinically see from outside. Yeah, that's okay. Why did you choose radiology or did you have radiology in the back of your mind since you started MBBS or is just after a NEET PG, so after your PG entrance exam you got a great rank so you chose radiology? What's behind this?
Actually, till my MBBS, I never thought of radiology. But during the internship, when I was posted in the radiology for 15 days, that time I met my professor in radiology at KPV Trichy. I just used to wonder how a person can diagnose by just seeing an image. Like he hardly sees the film for a minute, and he will tell this is the diagnosis. And I have how can it be possible? Like he will tell, like I remember one case like where there is a patient present with abdominal pain. We are not sure what it is, whether cholestasis, renal colic, or pancreatic pain, or some gastric something. But he saw the image. He told that this is a pseudocyst pancreas. This is not an active state, so you can't put a drain now. You need to wait for some time. He gave so many informations which we not even thought of. The DD
Okay.
was not even in our list. So
Okay.
that made me think of I need to do something like this only.
Okay. I want to ask this question. Did you not choose radiology because you have a better work-life balance?
No, actually, I always prefer to do the work which just give me everyday
Satisfaction.
satisfaction and kick, so that I'll keep on doing that thing for my lifelong. So
Because
that's why I choose radiology.
I've seen many people get into radiology thinking that it has more work-life balance, and they don't expect the night duties they're gonna be posted after when they get into their residency in the first year. That comes as
Yeah,
a surprise. Even I had a friend who didn't want to work all night, but he ended up in radiology and got a surprise when he joined it.
I got to know that.
Yeah,
During our
Deepak.
residency, it will be quite hectic only, actually. Like during the first year and second year, it will be quite hectic. During the final year, you'll be getting some free time. That too, we'll be using more in the studies and doing research articles and publications.
Okay.
So radiology is more over a clinical branch. It will be like not a 9 to 5 branch, even during residency or post residency. 12 hours of duty will be minimum there, everywhere.
Yeah. Because I know, because I've seen you guys work all night. And I just want to clear one thing because when you tell radiology to the common public, they just
Yes.
just think about what's radiology. I don't have any clue what's radiology. But when you tell them it's a scan doctor, they become like active. Oh, yeah, scan doctor, I know him. Like, what do you want to tell to the public about radiology? Because they are not got exposed to radiology more. What is radiology? What do you people do?
Yeah, actually, in my day-to-day practice also, I used to come across patients where they used to tell, doctor has advised me this scan, that's why I'm doing this scan. Even if I'm asked some complaints, what's your complaints, why you want to get this scan? And they will say, doctor only told me. They won't ready to explain the symptoms to me because they thought like we are some technicians. So for those people, I will just tell them that we are not just a scan doctor, we are a clinical radiologist. That too, we graduated from All
Who
India
topped the
Institute.
exams to get into radiology?
Yeah,
Actually,
definitely. We got actually my rank is approximately like 250 something in the INA All
INA
India
exam.
INA set in
Yeah.
All India rank. So it's we need to interpret the image. So without history, you can't interpret the image. So, and we already topped the exam, so we know much of a clinical side of the patients, and we know much of the imaging aspect
Imaging.
also. So, we will give a better conclusion. We'll come to a better diagnosis than the clinicians. I hope so.
Okay. Yeah, this is what people want to understand because radiology is not but scans. They need to get it correlated with the clinical and the physical signs what the patients have so that they can
Yeah,
give a
true.
better report. Yeah,
Mhm.
like what are the modalities we have in radiology to explain to a patient? Because what are the, if scans is a broad term, I think they have, for me, I have a knowledge what are the scans. Can you please explain from your side what are the scans do you usually actually have under radiology?
Like actually, it starts from X-ray because it was invented first, and then followed by ultrasound, CT, MR, mammogram, fluoroscopies, and currently we are having a DSAs. So these are the scans which a radiologist used to do. And apart from that, there is a nuclear medicine branch. They used to do some nuclear medicine imagings as well.
Okay, Deepak. Okay. What is the most used modality by you in the radiology? What scan do you use the most in the day-to-day practice?
Actually, it's the ultrasound I used to say because ultrasound is the safest and it is non-radiation, like it has no radiation to the patient and it is usually beneficial to the patient rather than any other thing, I would say. Like first you need to get the ultrasound done, like for any abdominal pain rather than blindly going into CT, start with the ultrasound and check
Okay.
where the lesion or something and then characterize the lesion based on the other modalities.
Okay.
Mhm.
Okay. So you are telling me that your USG ultrasound is the basic scan that a radiologist offers when a patient comes to.
Yeah, yeah,
Okay.
yeah, definitely. Mhm.
So when you are talking about this, you are telling something about radiation. Should a patient be worried when they undergo these scans about radiation? Is that much worryful radiation exposure is there?
Yeah, definitely. According to me, like I have seen at multiple places, whenever that if the clinician is not got to know what scan to be done, most of the time they always order a CT or MRI. So they need to localize first. They need to do a chest X-ray, see any lesion is there in the chest. Then if something is there for further characterization, you can go for a CT. Rather than doing a CT abdomen and chest and pelvis for all the patient, there should be some protocol. Start with the basic modality with low ionizing radiation, followed by ultrasound if it is helpful for the patient. Then even if for in pediatric patient, especially ultrasound and MRI are the best.
Yes.
Compared in MRI, you need to give sedation for the baby. So I would say the pediatric imaging was revolutionized by the use of ultrasounds lately.
Okay. Okay, yeah, I understand. So clinicians should be careful before ordering this test.
Yeah,
Just that it's
definitely.
available. You can't just go to a CT and put radiation over
True,
the
true, true, true,
patients,
true.
right? Okay. But I think it's as a surgeon, a clinician, I think taking a CT is an easier thing. I think because of the availability, it's I think everyone goes directly to a CT when patient comes with abdominal pain.
Yeah, true. Because of the availability as well as the cost wise,
Yeah,
it will
like
be much affordable to the patient.
I don't personally prefer going to CT directly because we start with the USG clinical examination USG
Yeah,
then.
true. Mhm.
Okay, I understand. Okay, Deepak, can you tell me some interesting cases you've seen? Because you are working in the All India Institute of Medical Sciences, which is a prestigious institute. Have you seen any
Mhm.
interesting case? Interesting case which everyone felt difficult to diagnose, but it took you seconds to find the case. Okay, this is the case. I have seen it. What is the one case?
Like neuro is the most fascinating thing for me. Like once the patient come with a seizure, everyone is thinking of something like mesotemporal sclerosis or some infection, some tuberculoma or something. But it turned to be like subacute sclerosing panencephalitis, which no one thought of.
Okay.
It's a very rare entity, but the neurologist even didn't thought of that. By seeing that classical pattern on in the MRI, we sure know that this is due to SSP only. Then we call the neurologist and we did a EEG. Then we got to know the patient is really having the SSP, but we can't able to save the patient by the time. But the patient finally passed away. So
Okay. Yeah, I understand. Okay, it's a great insight. Okay, I want to ask some kind of a not a personal question. It's kind of a question more personal to a radiologist. Does radiologist really have a big head weight? Because I've seen they rejecting scans, rejecting the time. They're telling I don't have time. You can go because no one knows what happens inside the console. No one knows how much pressure you put before reporting each and every scans. How much
true.
time you take before reporting the. Just people from outside think you are sitting in an AC room with a cool chair and you just tell I can't report it now, I can't tell. So from your side, I think you have to, as a radiologist, you have to tell the other clinicians or other people what you really go through in the room. That is how much tiring for you. You just have to explain from your side.
Actually, like there will be a lot of mental fatigue. Like it's not that simple because you need to know the entire clinical history of the patient. You need to go through all the reports, lab parameters, clinical history, and then, if possible, the clinical examination of the patient. And then you need to integrate everything into the imaging aspect. And you need to go through the scan very meticulously. And then you need to find each and every small finding which is there. And you need to connect all the dots. And then you need to come to a conclusion which is very beneficial for both the patient as well as the surgeon. It should not be unnecessarily leading to other investigation or something. It should finally come to a conclusion. Rather, if it is not coming to a conclusion, it should give a certain provisional diagnosis at least. So it's a very tiring job actually. Like during residency, we can avoid scans, but not as a consultant wise, I feel so. Most likely.
Yeah. I understand because personally I've been traveling with you guys for 3 years. Yeah, this is what people should understand. It's not like sitting in a sophisticated room and just having chilling coffee and just reporting. It's not that simple. It's the mental fatigue which affects them the most because it's not physically demanding, but
True.
definitely it's mentally demanding, and it requires much of a concentration over the screen for a long time. It's not just one scan they
True.
report a day. They report more than 20-30 cases, depends on the consultant and the caseload there. Yeah, Deepak, congratulations on scoring a rank of 97 in this NEET SS exam. So
Thanks,
what's
Hazan.
your future plan? What are you gonna do? Because already you've been as a radiologist, already you've been earning enough to make a living, not a living, more comfortable living. And why do you wanna specialize further in the radiology? Because you chose MD radiology, which is more of a diagnostic branch. Now, after all these 3 years being a junior resident, seeing scans, reporting, achieving the high of diagnosing cases, why do you want to move into a completely different spectrum of radiology now?
Like I told you, but I never thought of taking radiology itself till my internship.
Okay.
Like when I saw the my professor diagnosing cases like some different level. He's like that. I have met my one of my professor in the All India Institute. His name is Dr. Nihar. Like he
Okay.
used to diagnose case and used to treat cases. Like he has treated n number of AVMs and aneurysms. Like after assisting cases with him, I felt like no, this is my branch.
Okay. I
Diagnosing,
gotta get into intervention.
yeah, that gives me okay. I need to do this. Without that,
Okay.
it is not end for me. The
Like
radiology is not the end.
you
I need to
felt
do
the
something
same
else.
high as a
Yeah,
surgeon
definitely.
when you're doing
Yeah.
that intervention.
Yeah, and
Yeah,
it will gives a
definitely.
better satisfaction. So more than
Because
work-life balance,
because
the patient satisfaction is most
that
important.
branch is entirely different than what you're pursuing right now, because it
True, true, true.
demands long work time, it demands you long standing.
Mm,
You lost all of your sophistication and get into an entirely different thing.
true.
Yeah, good. Like, how do you see yourself in another 10 years? Because now
Sorry, I
you
didn't
are
get.
not a radiologist. Now you're going to become an interventional radiologist. That another feather on your crown. Now it's going to be next. So how do you see yourself in another 10 years?
Yeah, I'm just planning to join in some DRNB institutes currently. So I'm not sure where I will end up with. Either I will be end up with some of the All India institutes in Tamil Nadu or some of the top corporates in Tamil Nadu, most likely. Uh, More likely, I want to be a full-time intervention radiologist in future,
So
treating the patients with the.
interventional radiology is like a broad term. Where you want to do you want to specialize more further in that, like neuro radiology interventions
I
or
have more passion.
vascular, cardiac?
Yeah, I'm more passionate in neuro as well as gastro work.
Okay,
So
gastro.
future I will be doing these two work only, most likely.
Okay, very good. Now we spoke about you. I just want to make this video more better by creating some awareness among the public. So, when you see patients coming to scans, like for USG, why do you often
Yes.
tell them to come in empty stomach for some scans? Why do you often ask them to come in a full stomach for some scans? Can you just explain it to the people, like they can understand that?
Yeah. For gallbladder need to be well distended, the patient need to be in fasting. If the patient had a meal, the gallbladder will contract by means of cholecystokinin, and then we can't able to visualize the gallbladder better. So we might miss some stones or polyp which is sitting on it.
Okay.
So in those cases, the patient need to be in empty stomach. And if the patient has drank enough water, then the water will serve as a acoustic window for us to visualize the pancreas. So that will be visualized much better in an empty stomach with just a water rather than a more amount
Having
of
a meal.
semi-solid or solid food.
Okay.
Like same goes for the bladder also.
The empty stomach you're mentioning means it's not like having nothing. You can have water.
Yeah, you can have water. We can have water.
Water you
Definitely,
can
we can
have
have
how
water.
much ever you want, but you're not
Yeah,
taking any
sure.
meals like
Yeah,
biscuits or
definitely.
something. You're just having water. Okay,
Yeah,
what is about the full bladder thing? How much should
yeah.
they have water?
Ideally, like it should not be like this is your maximum controllable level. Yeah, it can be optimal also, mainly for the females because using the bladder as a window, we used to see the ovaries and uterus.
Okay,
So if you're a female patient, definitely uh, you need to hold your urine for a quite long time. For a male patient, I don't think so. It will be a much needed for male
need for
patients,
the full
basically.
bladder.
Yeah,
Okay. Like in some people they have like they're claustrophobic. Like claustrophobic in the sense to tell to the normal people, like when they get into some closed areas, they get that fear of being some compression. So I think these patients can't take MRI, right? Can't be used to take
yeah.
MRI.
Those are the scenarios in past, but currently there
Okay.
is an open MRI
Okay.
that the like currently whatever MRI we are seeing in our routine life in big corporates, everything is a closed MRI. Like there will be a big bore of magnet will be there. They will take us inside the magnet and the scan will be done. So most of the time patient will be looking all those things and they'll be fearing why I'm inside so much
Okay.
time. So they'll be having fear for most of the time. But open MRI means there won't be any magnetic bore around you. So you'll be lying in a table. So you won't feel like that you are in an MRI machine itself. You just lying down. So most of the patients who is claustrophobic will be better benefited by these things.
Open
Even
MRI.
the children will be better benefited by these things.
Okay. Yeah. Right. So when radiology comes into picture, there is another technology which also comes into picture along with radiology. That's artificial intelligence.
So
So where do you see artificial intelligence and radiology coincide with each other or replacing radiology? How do you see AI in radiology?
actually, I have personally used it multiple times. It further speed ups my work rather than replacing me. Like whenever I'm giving some reports for drafting, I used to dictate everything. It used to translate the dictate into a Word format. So it just simplifies my work.
Okay.
And personally, also, I felt like it can if you're having hundreds of x-rays, so if there is a minute fracture you might miss during because of the long workloads and fatigue, so that will pick the smallest of lesions and it will give it to the review for you.
Okay.
So and you will review again and you will uh, it will further refine your reports rather than replacing you. It
Replacing.
will never can replace you because no one can take a honest report.
Yeah,
That need to be
definitely.
taken, that need to be taken by a radiologist.
Yes, okay. Will you be comfortable if the AI replaces you in reporting X-rays and some basic scans? Will you be comfortable as a radiologist?
It can't replace, it will just give a first initial screening.
Okay, it
Like
will reduce your workload.
yeah, it like I will just share you a thing like in UK I think so they had conducted a study like in emergency they used to conduct n number of scans per day. So like we are triaging a patient into red zone, yellow zone and green zone, the A will triage the scans into the patient whomsoever is having a cerebral bleed or is acute ischemic stroke. Those reports will be come earlier to the radiologist rather than the scans which has no significant findings screened by the AI. So this will enhance the manpower. If you're having a very limited manpower also we can able to pick the scans, we can able to pick the findings and you can able to save the patient at the earliest. So
Okay.
this is how their workflow will be better improved rather than replacing a radiologist.
Okay. Yeah. And I also know you are the gold medalist in your university exams in Indian Institute of Medical
Yeah,
Sciences.
true.
MBBS graduate, what do you want to tell to them as about radiology? Whether they should have this idea of becoming a radiologist in the future, or should they choose anything else other than this? What's your take on this?
Personally, I feel like if any branch gives you a kick in, like you need to do it, you are like it makes you awe or wonders, then you need to take the branch. Like I have taken like that only. Like I'm going to pursue intervention radiology because of that only. So you need to think whether this will give you like satisfaction and whether this is like even at night 12 o'clock if you're seeing a scan, like you need to give your 100% and you need to want to diagnose the patient.
Okay.
You need to think about it whether you will be doing it for next 20-30 years down the lane. So you need to have a thought about it. Like if you want to be a clinician also the same thing, if you want to be a surgeon also the same thing, whether I can put this much amount of working hours in my life, leaving my family, doing all these things, you need to think about it, then you need to go for a shot.
Okay. So, what do you want to tell about the preparation? Because radiology preparation is different for exams,
Yeah,
even
true.
for university exams, radiology preparation is different. So, what do you want to tell about preparation? Like the preparation for the university exams and post getting into a INASS or a NEET SS exam, how do they have to prepare themselves?
For university exams, I would say like it depends on the university basis. Like just go through the previous university exams under which university you are currently admitted under, and go through all the previous year questions. And exams is just for passing. It should not be like you are just passing the exam. It
Okay,
should be like you should study daily. Like even whenever you are seeing some scan, you should try to give some differentials for it, and you need to know why this is correct, why this is wrong. And then whenever you are trying to see any case, try to finish that system or finish that entity in a day. Like if you are seeing some aortic aneurysm, try to read that day what is aortic aneurysm, try to read from the basic pathology onwards, clinical manifestation, clinical presentation, treatment, medical management, endovascular, intervention management. Like you need
everything.
to complete, yeah, you need to complete an entire spectrum. Then
Okay,
only you will retain more, and it is not like something, some science or something you will memorize and you will forget later.
okay,
Radiology is not only about science. Science are just for the exams.
okay.
That too only for the getting into radiology. Like in surviving radiology and passing out of radiology, with science you can't do anything.
Yeah, definitely, definitely. So, for a first year resident, one who has just joined residency in radiology, because radiology will be an entirely new world. Because in your internship, you would be exposed to radiology, you would have been sitting nearby the consultant, just scrolling around scans. You would not have that much knowledge because they just give you how to write a report, finish reports. This is the thing we have
Mhm.
exposed in internship.
True.
So, as a first year resident, when they come into the department, as a first year JR, everything will be new. The anatomy, the radiological anatomy will be new. The way of reporting will be new. The modalities will be different. Holding a USG probe will be different. Everything will be different. You have any ideas where they can learn these things? Like definitely they will learn in their department. So before getting into it or making it easier, is there any way they can make it easier in learning that thing?
The only way is be with your senior, ask him why is it, why it is not.
But
That will give you the
many
answer.
people don't get the privilege of having a very good senior. Is there any
True.
resources you used personally
Actually,
to learn?
during my second year, I got to know that eConceptual for radiology. There is a
Okay.
separate platform by Zainab ma'am. It is very helpful. So I
Okay.
would suggest like everyone should go and watch those videos. It will give a much better idea in a theoretical basis. For practical basis, there is no replacement than the seniors and the consultants. You need to put your feet on. You need to work. Then only you will get to know.
Okay.
And you need to read a lot.
Actually, it's seeing again, seeing again, reading again,
More
reporting
amount of
again.
discussion will give you a better solving capability in radiology, I would say.
Okay. Okay.
Engage in more discussions with seniors and consultants. That will give you a better idea.
Okay. 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 Okay, Deepak. It was nice talking to you. I couldn't
Thanks.
like. I want to know more about radiology. Want to know many things because there's time limiting factor is also there. It's just you given me your time in between your busy schedule, and I'm happy you came into this podcast to tell more about radiology, share your thoughts, share your views, how to see radiology as a person. Now we'll have a small playful round, which we used to call it as a rapid fire round. So for you, intervention or diagnostic?
Formative intervention.
Okay. Dark room or OT?
OT.
Okay. AI, whether it is a threat or a tool?
Tool.
Okay. One mistake you will never repeat.
Um, Diagnosing the scans which I already encountered, which I diagnosed wrong, I will never repeat the same again.
Okay. One advice to your younger self.
Engage in more case discussions, which will give you a better knowledge and insights in radiology.
Okay. Work-life balance in radiology. True.
In diagnostic, it is just 9 to 5, as you say. In an intervention, it is not like that. It's
Okay.
more of a patient oriented, so it will take more time to learn and doing stuffs.
Okay. Okay, Deepak. So from a whole of the talk, I have found that radiology is not just about images. It's about decisions that change life, that change diagnosis.
True.
Yeah, okay. So if you are someone considering this field of radiology, you can definitely go ahead and choose the branch if it gives you the factor, how factor, like Deepak said. So Deepak has broken down the facts about radiology and has told everyone, and everyone listening to this. So medicine is not just seeing the patient in the OPD or just operating the patient in the OT table. It's also behind the screens. There are anesthesia people and there are radiologists who just make way easier for diagnosis for the clinicians. And radiologist is also a clinician with an eye that no one else other than them have, because they see what no one else can see. Oh, that's what all this talk is about. Thank you, Deepak. Thank you for sharing your
Yeah,
time.
thank you, Adil. Thank you, Adil. Yes.